dozen. Nation. A dozen. Nation.
Suppose, for the sake of argument, that 300,000 people are out of useful work when they grow to be older, and that each one of them, if he could work, could produce $1,000 worth of new products every year. In other words, if the productive value were $1,000 a year apiece, 300,000 of them would earn $300 million added to the annual productive capacity of the United States. If we could restore every cripple in this country to some kind of useful occupation, it would do much to help the general wealth and well-being of the United States. It has been estimated the average saving from the reduction in tuberculosis alone during the past 20 years, resulting now in 12,000 fewer deaths annually, amounts to a per capita of $5 for every man, woman, and child in this state each year, or an amazing total of $60 million per year. Nothing can, of course, have so determining an influence upon the prosperity.
These were the words of Franklin Roosevelt speaking over the radio of New York State as its newly elected governor in 1930. In those words lies something that has been forgotten in America and in the world, something that, if not soon revived, will bring about conditions on this planet far worse than the 14th century New Dark Age. Obama's recent assault on healthcare is typical of those Nazi monetarist policies that will undoubtedly bring about that collapse very rapidly. The aversion of that outlook and the creation of a bright and successful future require that we not only scrap the Obama policy, but we must introduce positive conceptions of principle, like the principles of Franklin Roosevelt's Hill-Burton standard for healthcare. So, for our purposes here, let's take a look at FDR's Hill-Burton standard for our policy conception for healthcare.
Just a few years before Roosevelt became governor of New York, there was no certainty that he was even going to live. He had been struck with polio in 1921, a condition that was fatal and at best left its victim paralyzed and crippled for life. Roosevelt had been a rising political personality in New York politics, having been elected to the New York Senate after serving as Assistant Secretary of the Navy under President Wilson. He was very well known for the campaigning effort that elected Alfred Smith as governor of New York and later ran as his vice president for the presidency. It was on vacation from the campaign trail that Roosevelt contracted the deadly disease. In this period, cripples were shunned, not to be seen in public, and often kept hidden away at home or in some institution. Even Roosevelt's mother, Sarah, tried to convince him to retire and become a country gentleman. Doctors' concerns were not limited to Roosevelt's paralysis, but what concerned them to a very large degree was the mental and emotional trauma this experience would permanently inflict upon him, if not his possible sudden death. The 1920s was a period where public health was a mixed bag. On the one side, as of the turn of the 20th century, advances in sanitation in the U.S., like sewage treatment, systems for safe water, and anti-pest action, combined with scientific advances in understanding microorganisms and contamination, led to the reduction in many contagious diseases. Even before 1900, the U.S. had a downward trend in mortality due to the decline in the frequency of certain diseases, chiefly yellow fever, smallpox, typhoid, typhus fevers, malaria, and tuberculosis. There were quarantines and other measures to contain these threats, but this was not enough, and cures were still needed. On the other side, in the 1920s, one pattern that stood out, besides the lingering presence of typhoid and other contagious diseases, was the presence of poverty diseases and morbidity. Since Reconstruction of the South was abandoned by the enemies of Abraham Lincoln, the full integration of the United States territory was left incomplete, with a huge gap in living standards between the North and the South, contrary to Lincoln's intention. Hospitals and other facilities were still scarce in these areas, and where there were hospitals, they were understaffed, poorly maintained, and the number of people in a given county often outweighed the number of hospital beds available for treatment. This was a real infrastructure crisis.
This was the state of public health in the 1920s, and Franklin Roosevelt's misfortune was, unfortunately, all too common. Now imagine, there you are on your sickbed. You are that paralyzed political figure who's just been stripped of everything that you've worked for. With the threat of death looming, imagine suddenly you're struck with the harsh reality that you are actually mortal. You reflect, what have I done with my life? Having potentially lost the ability to carry on, but a feeling of incompleteness at the thought of not being able to do so, you ask yourself the obvious but shocking question. For what do I have to live now? What now is the meaning of my life? What must I do with my life such that it means something in the future when it is gone?
These questions must have driven Roosevelt to travel on a great journey through the depths of his soul, a longer and deeper one than we could possibly conceive. Months of reflection forced him to come to grips with what really mattered in life and what was really worth living for. Perhaps the strength Roosevelt required to get through this time in his life was rooted in his family history. In this period, he spent many hours studying American history. This had to spark many reflections of his family and naturally renew his hatred of the British Empire. Roosevelt was a direct descendant of the revolutionaries that founded the United States, going all the way back to the American Revolution. Ancestors like Isaac Roosevelt, who had collaborated with Alexander Hamilton, the man who established the credit system as the principle of U.S. monetary policy, and our U.S. Constitution. With this deep connection to the fight to establish the sovereign United States against the British Empire, Roosevelt could no doubt have situated his life and its meaning within the longer span of human history, rather than the animal existence of day-to-day experience. The present was of little concern now. It could be gone any minute. What was important was, when it is gone, what will the future have in store for future generations? During this period were also the many discussions he had at the prompting of his wife Eleanor with various political and community leaders who represented what Roosevelt would later call the forgotten men and women. This, along with Eleanor's persistent reporting of political events to him, afforded FDR the opportunity to develop a deeper insight into the hardships the people of the United States were really going through, even before the Depression. Besides his own hardship, Roosevelt developed a deep empathy for others. In 1924, it was confirmed by doctors that Roosevelt was not going to die and that he was recovering from sickness, but was still paralyzed. As he began to get better, he was told about a facility in Warm Springs, Georgia, where a man who had been lame had strengthened himself by learning to swim in a pool filled with saline water. Roosevelt's doctors thought this hydrotherapy could help in getting him back to the use of his legs, so Roosevelt enthusiastically obliged, and off they went. At Warm Springs, Roosevelt to a normal life. In 1926, he spent 2/3 of his personal fortune to buy Warm Springs in order to turn it into a transitional facility and preparation for community living, not as a grim asylum or hospital with strict regulations and bureaucratic institutionalization. Just 3 years later, Roosevelt was back on the campaign trail and was elected governor of the state of New York in 1929.
Roosevelt emerged with a higher sense of reality, a higher conception of the role government can play in the lives of people, and a new notion of what really mattered in life, a real human conception of value. Roosevelt got the kind of education you cannot find in books, and he would need it because mere book learning could not have prepared him for what was soon to hit the United States, the Great Depression of the 1930s.
Stuck to bank bailouts, cost-cutting, and fiscal austerity, FDR focused his economic recovery on the physical buildup of infrastructure, manufacturing, and reorganized money and financial institutions to meet the requirements of physical economic value. This was his approach from the time of his governorship until his death as president in 1945. Roosevelt understood that the only real economic recovery had to be thought of in the long term, over generations, not short-term fiscal periods. His public health policy was a key feature of this long-term orientation. Roosevelt was well aware of the scientific breakthroughs ongoing in the fields of biology and chemistry, where the fight to combat major diseases had yielded great improvements in the reduction of those diseases and other illnesses. These were remarkable achievements, but Roosevelt recognized that an all-out war was necessary if public health was to be taken seriously. He campaigned vigorously for support for new action to reorganize public health. In the 1930s, as governor, he set up the New York Health Commission, composed largely of leading scientists and doctors in New York, who were making advances in vaccinations, disease control, and other treatments. The task of the commission was to conduct a survey of the health facilities of New York and assess the availability of care, how it was distributed, and the number of hospital beds in each town and county. The question was the infrastructure in New York adequate to fulfill health care needs? In the opening of the report to the state legislature written by Governor Roosevelt, here's what was found and prescribed.
An outstanding feature is the recommendation of the Commission that county boards of health should be organized in all counties to provide for our rural areas more effective control of tuberculosis, venereal and other communicable diseases, the protection of maternity and infancy, the safeguarding of public milk and water supplies, more effective public health nursing service, and other elements of a modern health program. Originally, local public health duties were imposed on the cities, towns, and villages of the state. This system, originally created to meet the conditions of 1850, cannot possibly be adequate for the needs of 1931. Few, if any, of these small units can afford the services which modern public health demands. The result has been confusion of responsibility, lack of coordination, waste of effort, and excessive costs for the services rendered. Practically every scientific organization interested in public health has endorsed the idea of establishing boards of health on a county basis with full-time personnel. The Commission, therefore, presents as its most vital recommendation, and I urge upon you, the enactment of legislation substituting the county as the unit of local health administration in place of the town and village.
Replacing the town and village organization for the county organization was a huge breakthrough in policymaking, especially pulling it off in the middle of the Great Depression. Roosevelt's public health agenda coincided with his overall approach to economic recovery, which was all-encompassing. It brought the benefits of science and technology to areas of the state that were previously deprived of such benefits through the buildup of infrastructure and the renewed responsibility by the state, which didn't sacrifice the well-being of its citizens for monetary concerns. What was left to do now was to get the U.S. federal government to revive that sense of responsibility for the general welfare of its citizens, as prescribed in our U.S. Constitution, and dump President Hoover's austerity with an eye toward the future. Immediately after he served his gubernatorial term, Roosevelt was elected the 32nd President of the United States and immediately moved to turn the country around from the pain inflicted on it by the Great Depression. In his first 100 days, he reestablished the principle of public credit and kicked out the money changers. The credit policy was the subsuming feature of the New Deal and other national programs Roosevelt enacted. Without this reorganization, Roosevelt would not have been able to defeat the Depression and defeat fascism in World War II, let alone recreate the breakthrough health policy he had established in New York as a national policy. Ironically enough, as Roosevelt's New Deal went into action, Adolf Hitler was put into power at the same time, in Germany, 1933. Faced with the Depression in Germany, Hitler's approach was the exact opposite of Roosevelt's. Hitler's solution was to cut costs, which meant killing off the so-called dead weight in the economy, securing the power of the financiers that created him. Where were the first cuts? To health care. Hitler targeted what he called lives not worthy to be lived, that is, the poor, elderly, and crippled, among others. By 1942, at least 275,000 murders were conducted under Hitler's health reform. Meanwhile, back in the United States, our own crippled president devised a successful standard for national health policy. The center of it was the construction of general hospitals coordinated by federal and local governments, beginning with a survey of the existing capacity, just like in New York, followed by coordinating the federally issued monies with the states, counties, and cities for construction of new health facilities, and finally, an integration of these facilities through infrastructure to create America's first public health care system. This policy was later known as the Hospital Survey and Construction Act, or otherwise known by the names of its chief sponsors, Senators Lester Hill and Harold Burton, the Hill-Burton Act, which passed as law in 1946, a year after Roosevelt's death. This top-down coordination worked to solve basic problems in the healthcare field, like distribution of care, the availability of modern health facilities, overcrowding in existing facilities, and combating diseases that today may seem ancient, especially in poor areas where they were most vulnerable. A key feature was the provision that set standards for hospital beds per 1,000 people in a given county. From 1940 to 1946, the United States ratio of hospital beds per 1,000 people for community hospitals was at 3.5, far below the Hill-Burton standard. In many states, the ratio was far lower. In 1949, however, more than 16 million patients received bed care in hospitals in the United States. This was the largest number ever recorded. Between the years 1946 to 1950, mortality fell by 50% for maternity cases, appendicitis, and tuberculosis. The availability and use of facilities and provision of care of high standards of medical treatment was the cause. The primary function was to provide the necessary infrastructure to give access to the most modern care available, while promoting the development of scientific research and technology to combat deadly and infectious diseases. A good measure of this recently changed attitude was the increase of birth in hospitals. In 1949, for example, more than 86% of the births occurred in hospitals. In 1935, the percentage was only 37%. As of the mid-1970s, the nationwide average for beds in community hospitals was at the average Hill-Burton standard of 4.5 beds per 1,000 people. 80% of the hospitals built were in poor areas, and many of the rural areas had access to hospital care for the first time. In addition, the top killer diseases at the turn of the century were pneumonia and influenza, tuberculosis and diarrhea. The introduction of water purification, sewage treatment, and other sanitation practices, along with new drugs like penicillin, opened the prospect of eliminating these diseases. By 1950, these infectious diseases had fallen in rank far below the chronic diseases, like heart disease and cancer, as causes of death. The benefits of the Hill-Burton Act were received by American citizens long after Roosevelt's death, up until the introduction of the HMO system. Now is the time to revive the Hill-Burton standard and repeal the HMO system. Since the introduction of the HMO system, public health has taken a U-turn back to those pre-Depression, or better yet, feudal European days where accessibility of care was a novelty and disease was unstoppable. Look at our situation today. With the breakdown crisis of the world economy, the collapse of living standards and productivity lies a petri dish for all kinds of new diseases and pandemics, like the swine flu and resurgences of previously defeated ones. What complicates our situation is the president's ego-driven policy to cut health care in the middle of an increased vulnerability to these kinds of conditions in order to save money. The president seems to be suffering from a sort of narcissistic, willful amnesia, and has abandoned those lessons taught by the Franklin Roosevelt he says he models himself after, if, that is, he ever understood those lessons in the first place. In the final analysis, economic values are not based on money values, but are based on the principle of the immortality of successive generations, as Roosevelt demonstrated with the public health system. We must, as Roosevelt did, Come to grips with the fact that economies develop in a multi-generational way, not by market forces. Relive the experience of the sickly Franklin Roosevelt in your own mind and consider how the past got us here today and what future mission we'll create to orient our actions in the present. Our task today lies in being able to conceptualize this and act on it for the future policy shaping of the United States and the world. Be immortal, as Franklin Roosevelt was. The past may thank you, and the future just might be that much better than our present perilous situation.